inviting us. Kristen, could you arrange to have me share my screen?
You got it.
Great. Is that working?
Yes.
Great. Okay, so we are the Healthcare for All working group, and we are a group of activists, healthcare professionals, community members, labor organizations, all dedicated to guaranteeing healthcare for all. And we'll talk more about that, obviously, in the presentation. We are a partnership of North Bay Jobs with Justice and HPEACE, which is the Health Professional Social Justice Organization in Sonoma County. And we wanted to explore with you why we pay so much and get such disappointing results on healthcare, and what we can learn from other countries, and what we can do to make some changes. Just a quick review: we pay twice as much as almost every other country in the world for healthcare, and we leave a greater portion of our people uninsured than those other countries. And we've often been told that we have the best healthcare system in the world, but that's not true. The quality of our care is the worst amongst wealthy countries, and sometimes falls behind that of the third world. We have the highest rates of errors, the most dangerous country in the world, in the developed world, for women to give birth in, and our system's the least efficient of all wealthy countries. And because you live in this country, you can expect to die 4 to 8 years before people in those other countries. You know, and much of our healthcare is controlled by corporations and venture capitalists who dictate what's covered and what it costs. Most other wealthy countries have a government finance system where profit is not a motivating factor. We've been told to fear that a government finance system like in Canada would compromise care. But Americans are 9% less likely than Canadians to receive treatment for chronic disease, and at twice the risk of long waits for needing care for breast or colon cancer, and at more than twice the risk of dying while waiting for an organ transplant. Again, things are so expensive, largely because our system is driven by the profit motive with little price regulation, and our drug costs average almost 4 times that of other similar countries. And hospitals are regarded as businesses like any other nowadays. Patients, doctors, nurses, and other staff are treated like cogs in a machine that prioritizes profits, not patients. And this has contributed also to an exodus of healthcare workers due to increasing work stresses and inadequate employer support. And we also have absurd administrative costs. In the US, there's a huge amount of paperwork, like insurance checks and coverage authorizations. And compare that to Canada, where the billing process is much simpler, because there's only one payer, the government, and everyone has the same coverage. A US hospital requires up to 100 times as many billing clerks as a Canadian hospital of the same size. We spend more on healthcare administration only, than the entire US defense budget. And we have an epidemic of underinsurance with increased deductibles and copays. Out-of-pocket expenditures are out of control and will continue if left unchecked. And all of this has put 41% of adults into medical debt. 2/3 of all bankruptcies in this country are due to the inability to pay medical bills. And most of the people who went through bankruptcy actually had health insurance, yet they had insurmountable out-of-pocket expenses. With Black and Latinx residents struggling the hardest with medical bills. For the elderly, the cost of their care is astronomical in this country, much more than that of other countries. And we think that, when people get Medicare, that they kind of have little in the way of financial barriers, but that's not true. Medicare is not free. A healthy 65-year-old retiring today, if they live well into their 80s, can expect to pay $300,000 to $400,000 in out-of-pocket costs or premiums. Out-of-pocket costs and things that are not covered by Medicare, like dental care, eyeglasses, hearing aids, and long-term care. And we're all aware of how the cost of housing increases poverty, but much less aware of how the cost of healthcare strips wealth from the poor and working people. Even with public insurance support for many, the poor still spend a third of their income on out-of-pocket medical costs. So we're rationing healthcare by making it unaffordable for many. And this country has unacceptable racial and income disparities. I don't have to explain that to you. But they're widened by our health system. People of color are less likely to be insured as well as underinsured, receive less care as well as lesser quality care, face increased barriers when they do seek care, resulting in less trust in their care. And people of color face the grind of social oppression, stress, trauma, and environmental toxicity. The less money and power a family has, the more the health burden, the more the financial burden, and the more the injustice. But the gaps are not just about the wealth. Rich Black women in California and their babies are more likely to die in childbirth than poor white women. As Elizabeth Wilkerson has written, success, health, and education don't protect against the ravages of caste. The system charges immigrants more taxes, premiums, and out-of-pocket expenses than they receive in healthcare services. Compare that to the US born, who use more services than they pay. Immigrants, in fact, subsidize the healthcare of the US born. Undocumented immigrants alone subsidize the healthcare of the US born to the tune of $52 billion a year in this country. And those of us who live in rural areas are further burdened by the system. Rural Americans have less access to doctors and dentists, suffer worse health outcomes, and premiums for the Obamacare Marketplace Silver plans average 40% higher in rural areas. Hundreds of rural hospitals have closed, and many more are at risk of closure. And even those that remain open, the closure of maternity and pediatric units in rural hospitals add to the inequity, not because of our inability to do better, but because it's not profitable given our current system of reimbursement. And this has created maternity and pediatric care deserts, where women are 3 times as likely to die in pregnancy and in the critical year afterwards. Gender inequity is also pronounced. Women and members of the LGBTQ community experience lower rates of being insured, increased barriers to care, greater out-of-pocket costs, and more trouble paying those costs. And women who divorce are more likely to lose coverage than their male partner and less likely to be able to regain that coverage. America is one of the few countries that ties health insurance to employment. Currently, half of us get coverage through employers. The folly of tying insurance to employment was emphasized by the pandemic when 40 million people lost their jobs, which meant that many lost their insurance and millions are still without coverage. How many people lost their health coverage during the pandemic in these countries? None, because they don't link coverage to employment. So what do these countries do that's different from ours? They provide universal coverage to everyone. They invest in more primary care and social services. And not only does the government pay the bills, but it regulates prices, allocation of resources, and any private insurance to ensure that health care dollars are spent effectively. So what are the potential fixes to this broken system? There have been a lot of attempts to patch the holes, but they all have kept the same inefficient system that drives up administrative costs and keeps the same corporate control over healthcare decisions. While some of these Band-Aid repairs have helped some people, it funneled tens of billions of new government dollars, our money, into the profits of the insurance company. And because that, our working group strongly believes that we all deserve single-payer healthcare, sometimes referred to as improved and expanded Medicare for all, a single insurance plan that covers everyone. Instead of consumers and insurance companies, government pays the bills. Profit would be removed from the system. Businesses would no longer offer coverage since everyone would automatically have coverage. There'd be no longer any restriction on choice of providers. There wouldn't be any more out-of-network issues. In fact, there would be no more networks. The focus on health planning would be increased, while bureaucracy would be greatly reduced. No longer would corporations be making decisions about what's covered and how care is provided. And like in most industrialized countries, healthcare would be financed progressively, meaning that the wealthy would pay much higher taxes than working people. Workers currently pay disproportionately higher taxes, but most don't benefit from Medicare or Medicaid during their working lives. Instead, they bear the burden of steadily increasing costs. Having a single payer system would improve both their health and their finances. The impact on organized labor would also be very dramatic since, currently contract negotiations focus on maintaining hard-won health benefits, and that distracts from the efforts to improve working conditions, wages, and pension plans. And you no longer lose coverage if you switch or lose your job or get too sick to work. Right now, 1 in 6 workers in this country stay in an unwanted job to maintain their health benefits. So what about business? For all but the largest businesses, their costs to fund a single payer system would be less than what they're currently laying out for employee and retiree healthcare. And single payer would also be a boon for local governments, public agencies, and nonprofits, since they no longer have to finance health insurance coverage of employees and retirees. To use the county of Sonoma as an example, almost $87 million that's now spent annually on health insurance would be freed up, and much of that could be redirected to services, wages, and benefits. Single payer would transform the way we fund hospitals now, which punishes small community hospitals and those who care for a greater share of the and underinsured. But it would rather be paid for through annual global budgets based on regional and community health needs, kind of like we fund the fire departments. And there are a variety of proposals how Medicare for all would be structured, financed, and rolled out. Recent proposals in Congress cover dramatically more than any current public or private coverage. Hospital, clinic, dentistry, vision, hearing, mental health, all reproductive care, including abortion, medications, and long-term care would be covered. It would provide all who live in this country, whether citizens, immigrants, whether documented or not, with portable lifetime coverage, free choice of doctor or hospital, no restrictions, and it would eliminate all patient cost sharing. No copays, no premiums, no deductibles. Implementing this would increase the income of the poor by 29% because the burden of out-of-pocket expenses would be eliminated. It'd be the biggest anti-poverty program in generations. We have about 41.5 million poor folks in the country today, and if Medicare for all was implemented, 8 million would immediately rise above the poverty line. Working families no longer would have to struggle to cover the cost of healthcare. It would be universal and guaranteed. And it's important to mention that there's also a strong effort to not wait for the federal government to move forward on a plan. The California Nurses Association is spearheading a plan called CalCare. In California, we are big enough to implement single-payer system for all residents of the state that would look very much like improved and expanded Medicare for all. Whether it's developed on the federal or a state level, it's important to ask, how can we afford such a system that so generously covers everyone with no premiums, no out-of-pocket expenses? What would it cost? How do we pay for it? Well, currently we pay almost $2 trillion in taxes to fund Medicare, Medicaid, VA, Indian Health, and other similar programs. We'll need to find $1 trillion more to fund this system. So where would it come from? Well, back up a little bit to understand where options. In the 1950s, the tax rate on those who were the highest incomes was an average of 81% in the United States. and the rate applied to the highest inherited states was 74%. Clearly, these taxes on the rich didn't destroy American capitalism. It was a time of great economic growth. Things were more egalitarian, at least for some, and more productive. But since then, the base tax rate for the wealthiest has been lowered so that it's below that of even the poorest Americans. Increasing taxes on the wealthiest to just a portion of what they paid in the 1950s would more than pay for Medicare for all. And all current proposals, including proposals for implementing first statewide in California, money would be gathered through taxes where the wealthy and big businesses would pay more. That is, those who make more than $300,000 a year. Working people and mid-sized businesses would pay significantly less, and poor and very small businesses would pay nothing. According to a study that was just commissioned by the governor's office, without dramatic change, healthcare costs in California would increase approximately 30% in the next decade. That's an increase of $158 billion a year, every year over the next 9 years in California alone. However, if we were to guarantee healthcare for all by developing a single payer system, they estimated that we would instead save $500 billion with a T, $500 billion in the next decade. So it's clear that cost is not a barrier to its adoption. And most importantly, it's estimated that establishing in our country improved expanded Medicare for all on its own would save 68,000 lives a year. And in fact, in 2020, during the pandemic, it's estimated that it would have saved twice that. People who would not have died if we had guaranteed healthcare without financial barriers. So our priorities are profoundly skewed. A nurse who mistakenly kills one patient gets 8 years in prison. Our insurance gaps kill tens of thousands a year, and nobody's indicted. And surveys show that people are not happy with our current healthcare system. The overwhelming majority of Californians believe we should have a government-run system instead of GoFundMes or saving interventions. Of course, the transition would be challenging. Some in power claim that trying to dismantle the existing system and replacing it with one that's entirely new would be a non-starter politically and too disruptive to the economy. But this same argument was used in an effort to maintain slavery, fight child labor laws, Social Security, and Medicare. But disrupting a healthcare economy that's not working and replacing it with one that it would is precisely what we should want to do. You know, we've been lulled into believing that the current way of healthcare is the way it has to be. The system spends too much on healthcare that delivers too little benefit to too few people. It puts many of us in debt, perpetuates inequality, racism, and inefficiency, and it results in deaths that our rich country should have prevented. Dignity and fairness and justice is what the Healthcare for All group, working group is fighting for. And so we made this presentation to you all in the interest of, oops, I lost you here, in the interest of developing a partnership, letting you know what we're doing, integrating more these messages into all that's discussed. In order to achieve something like this, all people, progressive people, labor, elders, small businesses really have to get to understand what's going on so that they can be aware enough so that when we get close to achieving something of this sort, we don't get conned in by the lies that will be spread through the millions of dollars spent by the insurance industry and the medical industrial complex to try to scare us. I will share with you